Hello, everyone. I'd like to welcome you to this session on Searching Social Work Reference Center. This is part of your library network, the VHA National Desktop Library. My name is Ellen Westling. I work for EBSCO Information Services, and I've been with EBSCO now for 18 years. Prior to joining EBSCO, I was a medical librarian and worked in medical libraries in the Boston area. So I'd like to welcome you and thank you for your interest in Social Work Reference Center and, of course, also for your business with EBSCO. I'm just going to let Nancy Clark, your Director of Library Network Office, speak for a few minutes to introduce the session. Thank you.
Thank you, Ellen. I appreciate it, and I appreciate all EBSCO has done for us in doing this training today and multiple training sessions today. As Ellen said, my name is Nancy Clark, and I'm the Director of the Library Network Office for VHA. The Social Work Reference Center is part of our national core collection of online resources. It is part of a collection that includes over 7,000 online journals, 10,000 online books, and over 40 databases, and these are all available to all VA employees. One of our goals in the Library Network Office is to ensure that all VHA staff have access to knowledge and evidence-based resources that are needed to provide quality care. Social Work Reference Center and these other resources are available on the National Desktop Library, which is on your screen right now. This is an internet site with a very simple URL of www.va.gov/library. So it's available from any device with an internet connection. These resources should also be available from your local library's website. And I'd like to note that with Social Work Reference Center and our other resources, that these are available 24 hours a day, 7 days a week. You just need to have a device, computer, laptop, mobile device that connects to the internet. The information on signing up for a remote account is available on the National Desktop Library. If you look at your screen in the left-hand column, there is a tab that says Remote Access. You click on that, and there's a registration link. You do have to be on-site at the VA to register. That authenticates you as a VA employee and gives you the right to access all of these resources. So if you have trouble accessing your resources, I encourage you to contact your local library staff. And again, there are links on this website to take you to your local library staff if you're not sure of who they are. But that just gives you a little bit of background. And with that, I'm going to turn it back to Ellen to tell us, give us more details on Social Work Reference Center. Ellen?
Thank you, Nancy. I'm just going to give a very brief PowerPoint. First, let me just add about 4 or 5 slides just so that we all know what we're looking at. So this is, again, is a source called Social Work Reference Center. So it's a comprehensive reference tool designed to provide current evidence-based information for social workers and mental health professionals directly at the point of care. So it is not a traditional abstract and index database such as you would find in CINAHL and Medline. You can get journal content from this source, but it also has other kinds of content such as evidence-based care sheets, patient education, quick lessons, practice and skills. We'll be going through all of those during this session. It's written by social workers and mental health professionals from CINAHL and other EBSCO Health medical editorial teams, so it is a EBSCO Health product. We do use the 7-step evidence-based methodology to systematically identify and critically appraise all of the clinical content. And this literature surveillance are of hundreds of journals from around the world, occurs daily, and topics are updated as the evidence change. This identifies the type of content or components within your Social Work Reference Center. We have quick lessons. This provides a quick review of a disease or condition, and I'll show you these. Evidence-based care sheets, what we know, what we can do based on the literature. You have social work practice and skills and skill competency checklists if you're training others in social work practice or need a refresher of all of the skills required. assessment tools. There are also continuing education modules that are included in this source, so that if you have social workers or others that need to obtain continuing education for their licensure, accreditation, certification, these can be used. There is no cost to the individual. I'll be showing you these as well during the session. There's also a drug handbook, American Hospital Formulary Service, patient education materials in English and Spanish, and also best practice guidelines. And as I said, your HFS drug essentials are within this tool as well. And this is just your interface that we'll be looking at. So I'm just going to change my screen now and stop sharing for a moment. So your screen's going to change to do live searching. See if the right, okay, sorry, I just have to get this up here. Here we go. And this is the way I have to get into your site. So this is your social work reference center for your Department of Veterans Affairs. What you'll see, an easy to use search interface on this first screen, your home page. You can see there's a simple search box. There's content listed on the left-hand side that I could go directly into patient education or my diseases or conditions. There's also featured quick lessons and care sheets, as well as what are called trending topics. So this provides a client with the opportunity to go directly into a specific area if they wish. So in this case, I might be interested in post-traumatic stress disorder, and it quickly pulls up for me a quick lesson on military personnel and veterans post-traumatic stress disorder. This is an example of a document that can be found. And you can also see all of the different sections within this under the contents listing on the left-hand side. So this is the way is the format, so you can very easily move through the document, how the patient or client will present, what kind of client history will be retrieved, as well as diagnostic or screening tools that might be used. There's social work treatment summary, problems, goals, and interventions, any applicable laws and regulations, services and resources, things to think about, food for thought, red flags, things you need to know right off the bat before working with a client, and discharge planning, as well as the references used to create this document. So all documents within a Social Work Reference Center, you'll see on the right-hand side there is a toolbar. I can add things to the folder, which I'll explain in a few minutes, but it's the same of all of our EBSCOhosts. You could print, email, save, cite, or export a document as well. So this is a very easy tool, and I'm just going to go back to my result list. And since I only retrieved one, because I clicked on that link on the home page, I'm going to go back to new search. I just wanted to show you again under trending topics in practice, gives you broad categories. So if I was looking at advanced planning for end-of-life care, this is more typical of result list that you'll see in Social Work Reference Center. You'll have journal content as well as different components. Over here are your source types, and you'll see journal contents is one of those. But when I scroll down, you can also see all the databases being searched for this content on end-of-life care. And this was a pre-formed search. You can create your own searches, and I'll be showing you that as well. But this just shows you all of the content that's being searched. And if I wanted to limit to psych articles, I could click on this box and update. But perhaps more importantly, I can come over here as well. I could go directly into my continuing education or my quick lessons as well, or my care sheets, whatever content I might like to look at. I'm just going to click on New Search once again. So in this case, I'm going to look for brain injury. So I can just type in my search box. And again, I have some 82,000 results related to brain injury. I could have put in additional terms, traumatic brain injury if I wanted to, or acquired. And then you can see on the left-hand side, I can further refine this result list. I can use my date slider to get more recent content as well. And as I continue to scroll down, again, I can see the content that is available here. So if I was interested in evidence-based care sheets, I did want to show you what those look like. So I'm just going to click on that and update. And so these are now evidence-based care sheets related to brain injury. So I can choose whichever one I want. In this case, I'm going to choose my military personnel and veterans concussion. I could get the full text. I'm just going to show you the HTML, which is also full text, but you can see over here the contents of that. You can also see the author's name at the top and the date of the last update. And as you can see, this is we serve EBSCO surveys the world's literature, not just EBSCO's literature, to look for the best available literature. So again, we're looking for concussion, what we know based on the literature, and what we can do based on the literature. So we can see what we know, and throughout that, you'll see footnotes to all of these documents. That will take you down to the bibliography, which I'll show you in a few minutes. And then what can we do based on the literature as well with your footnotes? Many sites I've worked with have used evidence-based care sheets as a beginning point for evidence-based care guidelines. And then as we look at the references, you'll also see all the references have an acronym next to them, a GI, a PP, etc. And this will show you the strength of the research. And what you need to do is come down here to the coding matrix so you can understand what those acronyms symbolize. If there was a meta-analysis, it would have an M, or a systematic review if there was randomized controlled trials, etc. So you can see the strength of the research behind what we know and what we can do. And these are, again, identified in our evidence-based care sheets. So I'm just going to X that out on the left-hand side and go back and also show you our patient education materials. And the patient education materials, in this case, I'm going to go to my post-concussion syndrome. And these are written at the 3rd to 7th grade level. Again, the authors, the date of the last update. You can see the content here that can then be printed and shared with patients or patients' family. It also provides the social worker, the mental health professional, with some background information on this condition or disease, whatever you might be looking up, as well as you can have a direct translation here in Spanish. And this is not a machine translation, this is a person translation. So you can be assured if you're handing out the Spanish, you also know what the English, because if you speak English, you know what the translation has said. And again, I could print that content here, and I can also add that to the folder, and I will speak to the folder in a few minutes. I'm just going to go back again and go back to my result list, always using the links that are provided. And I also wanted to show you the quick lessons. I have a question. Oh, I'm sorry, I will slow down the mouse pointer. Thank you for that suggestion. I appreciate it. So again, you can send me questions or comments by using the chat feature at the top of your screen. So what I'm doing now is using the left-hand column, and I'm going to click right here where it says Quick Lessons. So here I could choose either one. I'm going to look at my quick lesson on care coordination. So I'm going to click on the HTML. Again, there's also a PDF. I just like to use the HTML during demonstrations and training such as this because you can easily see all the content presented on the left-hand side. And we looked at a quick lesson earlier during this session as well. But again, you have your red flags, things to think about, treatment summaries, social work, etc. Now what I'm going to do is again click on my result list to get back to my results and click on New Search in the upper left corner to create a new home page. I've been talking a bit about the MyEBSCOhost folder and adding content. I did want to show you how this works. If you search other EBSCOhost databases, you may be familiar with it, or it may be a feature you've not used yet. In the upper right toolbar, where it says folder, you'll see it looks like a folder with a little piece of paper sticking out. When I click on that folder, the folder opens. You can see the content I've added during this session. I could select this content and choose to print or email content, including the full text. I also have the option when I email or print to have the citation formatted according to a specific bibliographic style if I'm using it for publication or research report, etc. I'm just going to go back. I can also save this result. Again, having options. And I could also export it. Oops, I got to select my results. If I wanted to use a bibliographic management software. And then I'm just going to click on back. But what I can also do is this is a temporary folder once I sign off and complete today's session. If I wanted to get back to these documents, I'd have to go searching on the home page and look for the content. But what I can also do with to create what's known as a MyEBSCOhost account, I like to call it my virtual file cabinet. And this will be useful and be able to be used in any of my EBSCOhost databases. So what I'm going to do first is just sign in here, or I could also have signed in the blue toolbar in the upper right-hand corner. The first time you do that, you must create an account. And this is the form you must fill out with your name and email address, a username, password. The email address, you can use whatever email address you want. Most of the time it's used if you forget your username and password, you ask EBSCO to send it to you. So use one that's easy to access. I'm just going to go back, and I am going to sign in because I already have an account. Whoa, not like that. And this will then open up my personal account called Ellen's Folder. I should also mention anywhere you see a question mark icon such as this one to the right of the term Ellen's Folder, you can open that, click on it. It will provide help sheets that you can refer to or print off, whatever you might want to do. And also you'll see down on the left-hand side, I have customized folders. So right now I could have a new folder and create it for brain injuries and save it. So now we'll see brain injuries here on the left-hand side. I can also choose to move that content into my brain injuries folder. You'll see from prior sessions when I've worked with the VA, I also have, I have content in there, 5 articles I added on post-traumatic stress disorder. So this allows you to save results for the future. It's a very nice feature because you can come back to content as you need it. And I'm just going to go back. Okay, so we've looked at using the basic search box. For any of you familiar with EBSCOhost, you are building a search history. This was our S1 was our CAN search, if you will, from that link we did on advanced directives, and then we did our own searches, but I could go back to those result lists. I could save my search into my folder as well. I wanted to go back, though, and show you some of the other content and how you can also access content directly from the authority files, the file of diseases and conditions. I can come right here. And again, I could search for a term alphabetically or relevancy ranked. I can also click on a letter, And I just wanted to click on the letter so that you could very quickly see, oh, lots of schizophrenia here, all the content that's available here as well. I clicked on another letter. It just starts to show you some of the concepts, the quick lessons, the broad variety of content that's in here, everything from diseases to legal issues, treatment of older adults. Again, I'm just going to scan so you can start to see the breadth of this. Again, very useful content in your diseases and conditions. You'll see that I'm using the column on the left-hand side, but across the top toolbar, they're basically the same thing. Have it in both places. Now I'm just going to go into my practices and skills. And this is, again, just to show you all of these, I am going to go into my advanced care planning overview. So this is my content. Again, I can open it up as an HTML or a PDF. Just for purposes today, I'm going to show you this. Obviously, the PDF print's much nicer. But again, you can see the authors, the date of the last update, and again, all of the content here. This is a practice and skill to give you guidance in how to implement this care planning, all the other areas that you would need to know about, or if you were training others in how to do this kind of work. And again, you can see the broad range of contents on the left-hand side. And if I scroll down a bit, what are the desired outcome? Why is it important? Facts and figures. What do you need to know? Social work responsibilities in regard to advanced care planning, etc. What I also wanted to show you here is that in addition to, for lack of a better word, your white paper on advanced care planning, I can also link out to a skill competency checklist. So this will show you all of the steps to take when working on advanced care planning with an individual, a client. So you can see step by step what needs to be done and can follow this along. So this is, again, an excellent tool to use for training or as a review for all the responsibilities, new staff, etc. And as with all of our EBSCOhost documents, these can be added to your folder, printed, email, saved. Again, when you open up an individual document as this, it looks different than our folder. I can also cite here. Again, if I needed to cite it, please note it does tell you to double check it against the standard. I could also export. This is also a persistent link to this document. And I can also create a note. If I have a MyEBSCOhost folder, I could put a note in here who I distributed to, what I'm going to be using it for. Useful for Thursday presentation. And save it, and it will be saved in my EBSCOhost account. So I'm just going to go back to my new search again. And I do see. What is the website address for this? I will show you again. It's part of your VA National Library Network, and we can show that again at the end. Thank you for that question. So once we've done the practice and skills, we also can get into assessment tools. These are a variety of tools that can be used for measurements, psychological tests, questionnaires, research instruments, attitude measures. And again, we can click here for the assessment tools specifically to see more about those different tools. Here's a pain attitudes question. Again, I can just open up my full text. It will show you information about this tool, and usually it also shows you how you can obtain it at the bottom as well. And again, you have all your distribution tools on the right-hand side. So just going back to new search. And again, that was looking at assessment tools. Medications, your drugs. Again, this is American Hospital Formulary Service. So I can choose my Prozac, and again, come over here to my information, print, email, refer online, etc. We looked a little bit at patient education, but again, to show you the breadth of the content that's here as well. Just pop into another letter. So if we were interested in throat cancer, we could click on our topic. This will also show if you did a search on throat cancer. Remember, on the left-hand side, you'll see your sources, and you could limit to throat cancer patient education. So again, content I could print off for my patient or my patient's family. And again, I also have my Spanish version here. Here's the link to it. Back to new search in my upper left corner. So we also have practice guidelines. Again, specific areas, and we can also search within this as well. Many of these are journal content. You will see on the left-hand side under source types, I can go directly into the guideline that has been included. Now we're going to look at current legislation. This is this is not within, if you will, Social Work Reference Center, but it is a tool that will take you out to the National Association of Social Workers. So again, you can see content about taking action on different bills and legislative actions. I could also find my elected officials here by entering my zip code. You can subscribe to mailing list. You can find out about registering to vote, etc., and go to their home, their action center, or their social work. So it provides a nice, easy-to-use link right off your Social Work Reference Center. And finally, continuing education. So we're going to talk about this now. We'll do we have alcohol abuse in older adults. So when I wish to do a CE, a continuing education module, I must pre-register first. And the reason for this is that the individual who's taking this will be receiving credits. They need a place to be able to get back to get their certificates, to see which courses they've taken. And in addition to that, EBSCO will be audited, so we need to have documentation about who is taking these and such. So what you need to do is pre-register and utilize this form. And your email address that you include will be the email address where the activation email will be sent. And you must have this to register the first time. So please use an email address that will be available to you, that you will most likely use your continuing education credits via Social Work Reference Center. So I'm already registered, so I'm just going to sign in. And it's considered as part of CINAHL education, but what I'm doing right here is coming down to Social Work Reference Center. And this is my content about alcohol abuse in older adults. I do need to click here to accept and continue. I do get a variety of pre-study information. I also wanted to show you the FAQs. So this is where all the different questions will come in. We also have continuing education units for our nurses as well, and Rehab Reference Center, and we're in social work. So I just wanted to show you there's a link down here at the bottom that says Social Work Reference Center. And again, you could learn more about the the credits and the classes, etc. There are also the learning objectives are listed here as well. And also there are states that either accept or provide. So I just wanted to say it is state specific, so we try to provide that information here as well. So that was the FAQ. I'm going to go back to my course materials. You'll also see a toolbar at the top here. I can move around. I just need to click here to accept and continue. This is the content I need to read and study, print off, practice, whatever. Before I take my test for credits, I can take the interactive review, also known as the practice test. It will also give you the justifications if you're right or wrong. You can take the test. You do have 2 chances to take that test and pass it within a 72-hour period. And also you have developed, because you have registered for the continuing education modules, I do have a profile here which allows me to come back and change any of my information, my dates, or address, email address, password, change password, whatever I might need to do. I can also come back to any transcripts I've taken. You'll see I haven't taken too many courses. I did take one on internet addiction back in 2014, and that certificate is still here for me. Download certificate or email, etc., and any notifications. So that's the continuing education portion. Let me just go back here, of Social Work Reference Center. I did want to point out there's also an advanced search, not used very often, but you can search content within Social Work Reference Center with more of your Boolean operators, or also using field codes. And you can also come down here and use any of the limiters for the databases that are attached to this source. I also wanted to point out that there's online help here. Before I do that, to the left of that, there's something called Send Feedback. We welcome input from users of Social Work Reference Center, whether they're mental health professionals, social workers, librarians. If there's something you'd like to learn more about, or there's additional content or something you couldn't find, we'd like to know that. This goes back to our product managers. It does not go back to the Department of Veterans Affairs. And we like to hear from the front lines the kinds of things and questions you're finding or not finding within Social Work Reference Center, or suggestions for improvement. And to the right of that is your online help. And again, on the left-hand side, you can learn more about your basic searching. Also up here under browser requirements and such, and browsing the content that I was showing you, assessment tools, drugs, how you can read an article, the PDF viewer, and how the evidence-based practice editorial process occurs too. If you wanted to know more about that, you could look here in the content sources that are reviewed, all that kind of thing. And then the personalization goes into the MyEBSCOhost account, and printing and emailing, etc. And I know I've had a few questions. Are all the continuing education approved through the NASW? I believe what I was showing you earlier, that it is different states have different recommendations. Let me just go back into that, to the FAQs. So here are your FAQs, and we go down here to our accreditation Social Work Reference Center. So this is where we're approved. This can give you the information that was just requested in that question. And then you also have to contact your regulatory board. So we have some courses approved by the ASWB, as well as other courses approved by the National Association of Social Workers, and they're listed below. Thank you for that question. Always the devil's in the details, as we all know. Other questions or comments or something you'd like to see again? Oh, we will show you that how you can access this content. I know that was a question earlier. If there are no other questions, I'm just going to go back and change my screen, so just bear with me a moment. And hopefully open that up. There we go. Sorry, let me just come up here.
Ellen, you want to...
Yes, go ahead, Nancy. Please speak up. Thank you.
Okay. No, hit your back button.
Oh, back button. Sorry. There we go. Okay, and just speak up. It's hard for me to hear you. I don't know if others are having difficulty.
I'm sorry. I
Thank
had
you.
my mic pushed up out of my face.
I get it. Thank you.
No problem. From the VHA National Desktop Library, which is www.va.gov/library, very easy, you can, on the left-hand column, click on Find a Database. So, Ellen, if I could get you to click on that. And then this is simply an alphabetical listing of all of the databases we have available. So you just scroll down to Social Work Reference Center. As long as you are on site, that's all you have to do. And you'll get immediately into Social Work Reference Center. If you're off-site and at home, you would need to have an Athens account and go through Athens in order to get there. There also should be a link on your local library's website, and we encourage you to use your local library's website simply because they're going to have resources in addition to what we buy nationally. And on this site, you will only find what we buy nationally. So there'll be more, hopefully, available from your local library.
Okay, I think we're going to end a bit early. I'm just checking there are no additional questions. I want to thank everyone for your participation today and for your attendance. There will be a short online evaluation form when you sign up. If you could just take a few seconds to fill that out, it would be greatly appreciated. Thank you so much, and bye-bye.
Thank you, Ellen. Appreciate it.
Thank you, Nancy. Bye.
Bye-bye.